Often patients who can't move anymore due to pain tell us about their self-diagnosis: blockage in the lumbar, thoracic, or cervical section of the spine, and the SI joint. A certain movement triggers pain, stops that movement, and so they think there must be some kind of a blockage. I'm Liebscher Bracht, and I'm telling you that such a blockage is something totally different from what most people think it is. After this video, you'll know what a blockage really is and how you could resolve it. Start talking about the real nature of such a blockage. Our experience tells us that this feeling of a blockage occurs because muscle and fascia pull so hard and also against each other from both sides of a joint. That excessive pressure builds up and makes your body respond with pain to warn you about possible damage in order to prevent that. And, of course, damage ensues if you don't heed this warning and stop the movement. And everything is out of whack, the joints aren't aligned anymore. All that adds up to compromise correct movements. But if you normalize the tension in the fascia and muscles through our osteopressure technique, our exercises and foam rolling massage, the muscles yield and suddenly the blockage vanishes. This feeling that there's a blockage in the sense of a barrier, a turnpike that you can't pass, and that has to be removed first before you can move again, might be something quite real to you, but has no basis in reality. If the tensions are normalized, the muscles flexible again and soft, and the fascia don't pull as hard anymore, the movement becomes easier, the pain vanishes, and so does the blockage. To make it more tangible for you, I want to use the most common blockages to explain to you which muscles are involved in this and how to resolve these blockages. Look, let me start with the SI joint. It's located here between the sacrum and ilium. Here in the back, we have the big glute muscles in the buttocks, a very strong muscle that is attached here, and if it's tight, it pulls the SI joint together and increases the pressure. At the same time, you have the back extensors that come from up here, entering in there, and they pull everything down. And if they're tensed up too much, pull down the sacrum as well. And that again pushes into the SI joint. These are the push and pull forces I was talking about. And as always, the hip flexor is also involved in this. Runs into the pelvis, then along the lumbar spine. And since this muscle, when under tension, is also pulled together like this, you can imagine how the sacrum is pulled hard into the iliac bone, and that adds up to overall tension. If these muscles are relaxed, the glutes. In most cases, the SI joint blockage is reduced to almost nothing or even gone for good, and if you relax the back extensors and normalize the hip flexor tension, the pain will disappear, the blockage will be gone, and you will have full mobility again. And now to the so-called lumbar spine blockage, a very obvious case. Let's begin in the front, where you can find the root cause. A minute ago, we were talking about the hip flexor, and it plays an important role in this. It pulls the spine inwards, and so hard that at some point you might experience a slipped disc. And it's not as if the disc suddenly feels like venturing inwards, but because it is pulled this way by the hip flexor or a part of it. And this pull is so hard that even a vertebral body can be dislodged from its assembly. Imagine that. That shows you how strong these forces are. And now, let's go to the opposite side. Remember, here, everything is being pulled inwards, but since people want to stand erect, the back extensors pull against this. That means the hip flexor pulls you forward and the back extensors pull you backwards. Where does all this force go? Well, it comes down on the discs because the vertebral bodies are being pushed together. That also creates pressure and pain. Your brain, where everything is controlled, where pain is generated, and here we are in total agreement with modern pain research, creates pain to protect something down there. Prevents a disc prolapse, a slipped disc. arthrosis in the facet joints, or a spinal canal stenosis. This is what the pain is good for. If you feel this blockage and you can't move anymore, that means the forces are so immense and your body wants to tell you, similar to lumbago, which is more or less a blockage in its purest form, no movement anymore, please. And then you relax the hip flexor, the back extensors, also the glute muscles, because they are involved via the fascia. The entire situation is under control again. The blockage will be gone, the pain too, and suddenly you can move again. The same is true for lumbago, by the way. Let's go one level up to the next blockage area, the thoracic section of the spine. It's quite interesting, the thoracic spine. Here, we not only have high tensions in the back, but also something else. And it's the rib cage that is being pulled down if the abdominal muscles are shortened, which is the case with most people. And don't be fooled with all the blubber here, because when we say shortened, we're talking about the muscle cord underneath that is tensed up. It may be soft on the top, but don't be fooled. A six-pack doesn't show with everybody. What's important here too is the diaphragm. The diaphragm stretches along the costal arch like a tent on the inside. For those of you who don't know, the diaphragm is the breathing muscle. It rises and falls, and in this way brings air into the lungs, oxygen, and pushes the air out again. In most people, this muscle is also tensed up, and people breathe shallow. Everything stiffens up and becomes hard. And if the tensions become too excessive, you'll have blockages here too, and you can't do certain movements anymore. And if you feel pain shooting up in there like a stabbing, everything's blocked. If you relax your diaphragm, you can relax the muscles in the back. Everything that is tensed up here will relax, and so all the blockages and pain are going to disappear. And last but not least, one level up. The cervical spine, your neck. It's tough times for the neck, with the back rounding due to too much sitting at the desk and this nerd neck you have sticking out. Imagine everything here in the back becomes stiffer and harder. And then we have the sternocleidomastoid muscle for rotating your head. This muscle runs from the back here to the front into the clavicle and the breastbone, and if tensions here become too excessive, because the body has to somehow manage to keep its position and keep it normal to prevent any damage, then it could happen up here that certain movements, rotating your head, for example, become impossible. You freeze up. Relax these tensions, and the so-called blockage will disappear instantly. Because this imaginary barrier, something blocking you from moving that you have to overcome, does not exist. Get your muscles flexible, reduce tension, and here too, the blockage will simply disappear. If you want to do me a big favor, maybe as a token of appreciation for now providing more than 1,000 free of charge videos, then please share this video, because blockages pester a lot of people and this information should be made known. Help us with that. And now, you may ask yourself, well, what am I to do with all these muscles that are tensed up too much? In our system, there are three options. Number one, we press as a therapy on certain points to relax the muscles and thus free up the so-called blockage. There's an osteopressure treatment available to you as a patient. This teaches you which points to press on to have this effect. That is the fast-track method to get rid of the pain. Number two, you do exercises, and that is the most sustainable path. Exercise to relax and normalize all the muscles and fascia that are suffering from excessive tension, that are shortened, matted up. Your body does the repair work, normalizes all these tensions, and will get rid of the blockage and pain for good. If you continue to do these exercises, remember, these blockages are the result of one-sided activities. You sit too much or fail to do any other activities. In the final analysis, these are the root causes. We want you to get on with your life the way you like it and give you these exercises, maybe 15 minutes per day, that help you to compensate in a way that allows you to continue with your life, but without pain and so-called blockages. And number 3, the foam rolling massage. The term itself tells you a lot already. We roll out the fascia in a way that relaxes the muscles and fascia and pushes the waste material through the intercellular spaces, and this is like a major spring cleaning for your body. These are the 3 options to handle this situation, to get rid of the pain and prevent blockages. Which of these 3 options you want to go with depends a bit on your taste, how you want to proceed. But these exercises are really important, I can tell you that. Because this is one way to compensate for this lack of physical activity in our daily lives, doing these exercises. If you go with all 3 options, that would be optimal for dealing with the situation. We've compiled some videos for you that demonstrate the various techniques. Check them out and see how they work. Clicking up here takes you to these exercises, and in our premium channel, you'll find all 3 techniques listed systematically in categories so that you can specifically target your so-called blockage and dissolve it. Give it a try. We've created a wealth of exercises for you. Bye, and see you soon.